When Terry made a trip to the Morris Hospital emergency room several years ago, she had no idea how much her life was about to change. As a single working mother, she was used to life's crazy curveballs. This time was very different. Terry was diagnosed with a brain tumor and needed surgery in Chicago. To make matters worse, she suffered a stroke during her surgery that temporarily paralyzed the left side of her body. Her surgeon suggested rehabilitation closer to Chicago, which meant leaving her 9-year-old daughter. For Terry, that just wasn't an option. When Terry learned about the Morris Hospital's patient transportation program, she knew the free service could be her saving grace. At that time, Terry couldn't physically drive or financially afford to get to and from the medical appointments she desperately needed to survive. But through the patient transportation program, Terry was able to coordinate 6 weekly appointments with her doctors, her physical therapists, and other caregivers. Terry's young daughter was also able to accompany her mom on the bus. Together, the two of them credit this service with saving their life. Terry says that she was able to continue to raise her daughter, live with dignity, and make her health a top priority. Terry's story is one of many that can help us understand how critically important reliable transportation is to having access to high-quality medical care. According to the Community Transportation Association of America, approximately 3.6 million Americans miss or delay medical care because they lack appropriate transportation to their appointments. Whether it's because of a lack of financial resources or reliable and affordable transit options, care for the most vulnerable populations can be fragmented, unmanaged, and uncoordinated. In the late 1990s, 2 hospital employees saw an opportunity to positively influence access to care for those Morris Hospital serves. Retired Vice President Dennis Mahoney and former coordinator specialist for outreach Barbara Nieder identified a need in the Marseilles area for reliable non-emergent patient transportation. They dreamed of a program run by a small staff and several volunteers that would allow patients to remain independent through illness and immobility and overcome barriers to obtaining excellent medical care. Their dream became a reality after Morris native William Spellacy purchased a bus for the program. The hospital began offering the service in December of 1998 and gave 4 rides that year.
When we started the program in December of 1998, we gave out 4 rides. At the end of our first year, we gave out 3,600 rides. And in this past year, in 2016, we had 17,750 some rides. I remember one gentleman one time, the older population, sometimes their families have moved away or they are working, and this gentleman called one time. Actually, it was his wife had called and asked about the services because she didn't know, and we set up the ride, and before she got off the phone, he got on the phone with me, and it's so impactful to me because he was in tears telling me how this took the weight off of him. He was always the driver.
19 years, 5 employees, over 100 volunteers, 9 buses, 2 vans, 2.5 million miles logged, and more than 225,000 trips later. The Barbara J. Nieder Patient Transportation Program continues to make a significant contribution towards Morris Hospital's mission of improving the health of area residents. Throughout the years, and thanks to the generosity of many, the Auxiliary and Foundation have provided funding for the majority of the patient transportation vehicles. Providing for these buses through philanthropy helps reduce the hospital's financial commitment to the service, which is $140,000 annually. Through the Foundation's new endowed fund for patient transportation, we have the opportunity to extend our impact even further. A growing number of individuals have come to rely on this service. It has made the difference between seeking regular care or going without. It has eliminated the burden on busy or distant family members. It has made people feel independent and self-sufficient. This program makes many of our most vulnerable residents, the elderly, the disabled, and economically challenged, feel valued and supported. Everyone in our community deserves access to the best care possible. Your support for the new endowment will not only ensure financial support for this vital program today and far into the future, but will also provide reliable access to medical care for future generations. With your help, the next generation will benefit from this new endowment. Remember Terry and her 9-year-old daughter, Bethany? What if I told you that because of the compassion and incredible care Bethany witnessed while her mom rode the patient transportation buses, she has decided to pursue a career as a caregiver? And what if that 9-year-old girl, 16 years later, chose Morris Hospital to live out that dream? This is Terry and Bethany at her paramedic graduation in 2013. Today, Bethany works at the Morris Hospital while finishing up her nursing degree. She plans to serve our community at the Morris Hospital because she appreciates how much the hospital takes care of this community with programs like the patient transportation. The spirit of generosity for patient transportation began in 1998 and still exists today. We need your support to provide for this important service for years to come. Please consider a gift.